Hello, everyone. Today I will present a study titled Effects of Acupuncture for Radioactive Iodine-Induced Anorexia in Thyroid Cancer Patients, a randomized, double-blind, sham-controlled pilot study. This study investigated whether acupuncture could help thyroid cancer patients who experienced appetite loss after radioactive iodine therapy. First, I would like to briefly discuss the background of this study. Thyroid cancer is one of the most common endocrine cancers, and many patients receive radioactive iodine therapy, also called RAI therapy, after thyroidectomy. RAI therapy is effective because radioactive iodine is selectively absorbed by thyroid tissue. However, it can also affect other tissues in the body, including the stomach, salivary glands, and nasal mucosa. As a result, many patients experience side effects such as nausea, vomiting, dry mouth, and especially anorexia or loss of appetite. Cancer-related anorexia is clinically important because it can reduce nutrient intake, delay recovery, worsen fatigue, and significantly decrease quality of life. Despite this problem, there are limited treatments options specifically for RAI-induced anorexia. At the same time, acupuncture has become increasingly popular in integrative cancer care. Previous studies have suggested that acupuncture may help with chemotherapy-induced nausea, pain, fatigue, and sleep disturbance. However, before this study, no clinical trial had specifically examined acupuncture for appetite loss caused by radioactive iodine therapy in thyroid cancer patients. Therefore, the purpose of this study was to evaluate both the efficacy and safety of acupuncture in this patient. The main objective was to determine whether acupuncture could improve anorexia symptoms, appetite, and quality of life in thyroid cancer patients after RAI therapy. Our researches also evaluated whether acupuncture treatment was safe. Now, let's move on to the study design. This was a randomized, double-blinded, sham-controlled pilot study. The study was conducted at Dunsan Korean Medicine Hospital in Korea. A total of 14 patients were enrolled. The participants were randomly assigned into two groups, a true acupuncture group and a sham acupuncture group. Each group contained 7 patients. Importantly, both the patients and the acupuncturist were blinded to treatments or location. The sham needles looked identical to the real needles but had blunt tips that did not penetrate the skin. This design was intended to reduce bias and placebo effect. Now I will explain the participant selection criteria. Eligible patients were between 20 and 65 years old, diagnosed with thyroid cancer, and had received radioactive iodine therapy within 10 to 60 days before enrollment. Additionally, participants needed to have significant appetite loss defined as a visual analog scale score greater than 4. Several exclusion criteria were applied. Patients were excluded if they had severe psychiatric disorders, other disease affecting appetite, severe pain affecting food intake, pregnancy, or use of appetite stimulating medication. These criteria were designed to minimize compounding factors. Sorry. Why Kim Sham acupuncture? Kim Sham acupuncture needle with a double blindness was used in this clinical trial by placing an acupuncture needle in an acupuncture point within a depth of about 1.2 millimeter through a real acupuncture needle that flutters to 1.2 millimeter, which has an average about the skin pain container, and the Kim Sham needle that stimulated pain receptors by acupressure to 1.2 millimeter. In addition, several papers have already been published before this clinical trial to prove the acupuncture effects of double-blind intradermal acupuncture. Next, I will explain the acupuncture intervention. Sorry. The patient received acupuncture 3 times per week for 2 weeks, result in a total of 6 treatment sections. The acupuncture points used in the true acupuncture group were LI4, LR3, SD36, SP6, and K12. These points were selected based on traditional Korean acupuncture textbooks. For the Sham acupuncture group, our researchers used special Sham needle developed by Kim Sungchul. These needles looked identical to real acupuncture needles, but they did not actually penetrate the skin. The needles remained in place for 30 minutes during each section. not manipulation, was performed to induce the ducky sensation. Now let's discuss how our researchers evaluated the outcomes. The primary assessment tool was the FAACT questionnaire. FAACT questionnaire evaluates appetite, anorexia symptoms, and overall quality of life. Another important questionnaire was FACTG, which measures general quality of life in cancer patients. FACTG includes physical well-being, emotional well-being, social and family well-being, and functional well-being. Our researchers also evaluated appetite severity using a visual analog scale, body weight, body mass index, and hormone level, including HTH and cortisol. Measurements were taken before treatments, during treatments, after treatments, and at follow-up. The most important finding of this study were relative to quality of life outcomes. Our researchers found statistically significant improvements in TOI scores, FACTG scores, and FAACT total score in the true acupuncture group compared with the sham group. TOI stands for trial outcome index and mainly reflect physical and functional well-being. This result suggests that acupuncture may improve physical symptoms, daily functioning, and overall quality of life in patients experiencing RAI-induced anorexia. The improvement was especially noticeable in the physical well-being domain. This is clinically meaningful because physical discomfort strongly affects recovery and daily life in cancer patients. However, objective measurement showed different results. There were no statistically significant difference between groups in body weight, BMI, HTH level, or cortisol level. This means that although patients reported feeling better, the treatment did not produce measurable physiological changes during this short study period. Now let's discuss safety. No acupuncture-related adverse events were reported during the study. One patient experienced cold symptoms and indigestion, but these were considered unrelated to acupuncture and resolved naturally. Therefore, our researchers concluded that acupuncture appeared safe in this patient population. The study had several limitations. First, the sample size was extremely small. Second, the treatment duration was short, only 2 weeks. Third, there was no treatment control group. Fourth, the sham acupuncture may not have been a truly inert placebo. Finally, objective outcomes such as weight and hormone levels did not significantly improve. Future studies with large sample size, longer treatments period, and improved control method will be necessary to confirm these findings. Despite these limitations, this study still has clinical value. The findings suggest that acupuncture may serve as a supportive therapy for cancer patients, supporting from appetite loss and reduced quality of life after RAI therapy. Thank you very much your attention. Thank you.